Thank you, Mr. Shamans, for the presentation. I would like to thank Professors Mauro Black, Atal Singhal, and Professor Charles Hillman and NNI for the invitation to participate in this so important workshop. In these difficult times, I really do expect to receive you all presently as soon as possible in Brazil. First of all, I would like to present my disclosure of interests. I have many supports and I'm a member of boards of many industries, but I do not permit any kind of interferences in the contents of my presentations. Well, as you know, in many regions of the world, developing countries are facing different stages of nutrition transition. Malnutrition affects individuals, households, and populations. And we need to face all the problems regarding the consequences of a scarcity and also the diseases of plenty. Individually, we have different cycles of life that would be different from prenatal period to the different cycles of life. In the households, we have many different individuals that are affected by different types of malnutrition. As for populations, we have to cope with the problems of the malnutrition, undernutrition, overweight, and obesity in different regions. Some years ago, the World Bank has shown a trend of obesity in many regions of the world. Latin America and Caribbean, as you see in red, had the worst scenario. Nonetheless, 10 years before the worst scenarios, we reached high numbers of excess weight and other forms of malnutrition very, very early. In a research that was done by our group in a representative household survey of Brazilian children from 2 to 6 years old, we've seen that in this Nutri Brazil Infancy study, we could describe a very important trend for precocious excess weight and also hidden hunger with nutritional risk of intake of iron, vitamins, minerals, and especially zinc and calcium. When you see this graphic of anthropometrics, we see that we had almost 5% of our children with morbid obesity, and excess weight reached more than 27% of all children. 11% of them were obese, and these were children below school years. When we discussed the trends in the last surveys from Brazil from 74 to 2009, we could see a very important increase of overweight and obesity in boys and girls. And especially you can see that in girls, 10 years ago, almost 32% of our children were obese. And the average number of children with excess weight reaches almost 40%. That is very, very, very worrying. That's why we had to understand the nutrition transition in our countries. We have to evaluate the modification and the phenomena that we had behind the nutritional transition in our country, getting a depth portrait of food patterns and eating habits, as well as lifestyle modifications that we had in the last few years. As you know, Brazil is a big country with many differences and very important socio-economic differences. The social differences would lead to very important differences on income that could be important to guarantee food access, health access, the importance of having different diseases in different regions, and especially all of them were related to modifications in the environment. Recent modifications in our societies led to modifications also in the women's role. As you know, in different countries, they have multiple tasks. They had advances and setbacks in many societies, but we could see that we had a very important modification of physical spaces for meals and food preparation, and changes in family and personal relationships with reduced and frequency of sharing meals. We had lost our cultural identity in the act of preparation and the recipes because of the globalization of the habits and new customs. What are the current challenges that we could face in Brazil, especially for toddlers feedings? As you know, the situation of nutrition in Brazil is characterized by these three pillars: poverty, poverty resulting from social inequalities, and this would lead to social and food insecurity. Socially vulnerable families have higher rates of violence and discrimination. They have an environment that is always not suitable for physical activities. As nutrition, we have very low rates of breastfeeding despite all the programs to increase it. We had a very important early weaning, and the complementary food that is increased in the last years are high in sugar, fat, salt, and we are still using whole cow milk without any modification in the first year of life. With the COVID-19 pandemic, we had an increase of poverty. We had an increase in all the social differences in different regions of our important cities, especially from the urban and rural, in the peripheral areas and the central areas of the city. And this led to an increased food insecurity. That's why we had to understand that there are social vulnerable families during this pandemic. They had very important characteristics. First of all, they have an impossibility of social distances, especially in low socioeconomic levels. Children were at home 24 hours a day, and we had a problem that is very important in our country is the lack of school meals. This could lead to more domestic violence, malnutrition insecurity, and resulting from the unemployment, the socioeconomic crisis, the nutrition outcomes are very difficult to understand. We have to see what's happening now and what we'll have after the pandemic. So the nutrition after the COVID-19 will be other problems that we were still facing before the problem that are malnutrition, hidden hunger, and obesity living together in the same society. So, what are the opportunities to enhance toddlers feeding? We have to understand that all the problems in our country, as it is in different other situations, must be related to a multidimensional context of the challenge. We have to transform them in opportunities. All of them must promote adequate nutrition to children and must be based on a framework of to modify families, schools, and the obesogenic environments that we still have in our country. Some specific actions that were done in the past or are still being held in our country, but with very discrete results, were programs related to combat malnutrition and hunger, especially in the years 70 and 80s with the Zero Hunger program. The iron folate fortification of flour that is mandatory since only 2002, with very difficult follow-up on surveillance, and they are not accorded with the promotion of universal healthy eating habits. Brazil National School Feeding Programs is one of the biggest in the world. It is one of the most important initiatives in school feeding, but they are mostly regular. We are not using local foods, and meals are still promoting food for malnutrition. And we just forget that we are in the late stage of the transition on nutrition with excess weight and obesity. So one of the opportunity windows that we have are the key meals. That's why we could transform breakfast as an opportunity to increase the amount of milk that is very, very low. Dairy products are very low in our society. So we could use milk not only as source of calcium, but also a vehicle for cereals, for whole grains, and especially we could transform snacks for a more organized and planned meal. We could have sometime an organization of these meals, and we could transform homes in a more healthy environment. As for the main meals, it is an opportunity for socialization, for limits, and especially to get together family again. We had learned some lessons from the virus, maybe not, but we know that we still can eat with our families. We have advantages of families together, but it depends very much on the socioeconomic level and the socioeconomic crisis. It's very difficult to have some of the possibilities that we have in high classes in the slums or in the outskirts of our cities. Lower classes, as you know, will always have all higher consequences of anything. Thus, we learned that our children cannot be left alone. They must be evaluated at a routine care service, even in the presence of crisis. That's why we still had the increase of obesity, the increase of hidden hunger, of screen time that we were combating all the time. Now it is an ally for us, and we still have sedentarism. We do not know what will last. But we have to understand that our future will start with many possibilities of changing. First of all, we don't know if our nutrition will be more flexitarian, more plant-based, healthier. We have to cope with the idea that not whole home food is healthy, not all packed foods are bad. We have to try to modify the content of sodium, sugar, and fats. We have to increase all the nutrients that are lacking, like fiber, vitamins, and minerals, but we still have to have affordability, pleasure, and responsibility. But we have also to understand why all the programs are not working in our country. We have a lack of continuity and maintenance of sources. We have political changes, all new elections, and we have new old problems. We are still working to solve the problems of infectious disease like dengue, malaria, measles, and all the things, and we have to cope with the new ones. But we have to understand that also what works in small scales, that we are very good on it, does not always work in a country of a continental size like Brazil. So the lack of community commitment when we do not see immediate results are very important for the continuity of our programs. So we have some take-home messages for all of you. We could discuss that all the sectors of our society must have some ideas to promote healthy feeding habits in our children. First of all, in schools, we have to transform our schools in a nutritional educational center and not have only nutrition as a day of fruits, a day of vegetables, a day of the Indians, a day of anything like that. We have curricula that must be part of the daily program of our schools. We have to promote regular physical activity. We have to have availability of a healthy and adequate meal and snacks, even in public or even in private schools. As for families, families must be very active and participate in children's feeding, cooking with children and kids, and reserve a time for family mealtime. We have to provide healthy food and examples for all the society. As for food industry, they must develop strategies to improve quality of food composition. They have to try to use better products, fortification of foods, supplementation, and especially we have to be very clear on open communication and clear and right communication to the society and all the sectors. And finally, for government, we have to be very transparency. We have to have policies to control and regulate directed marketing to food to children. We have to have safe spaces. We have laws that are not controlled, but we have to promote physical activities, and we have always to reduce inequality in the access of nutritional food. So as the final conclusion of our take-home message, we have to have an integrated system involving families, the schools, governments, and food industry. We have to have a commitment of all sectors that are involved in children feeding. We have to effective outputs to reduce children's overweight and obesity, but also to tackle malnutrition. We have to promote healthy eating habits that will impact life course. And also, we have to be prepared previously for health and educational crisis. We have to be prepared to discuss all old diseases that we have together with the new ones, and also to be prepared to have both at the same time with all the problems of resources that we still have. So thank you very much, gracias e muito obrigado.